Hello, everyone. We would like to thank the organizers for this opportunity of being here and presenting our project. Thank you very much. So we are here to present our survey called the 2023 Ehlers-Danlos Unmet Needs Survey for patients, carers, and healthcare providers. Oops. Yeah. So we are presenting ourselves.
Yes, good afternoon. I'm Charissa. I'm from Belgium. I am a patient advocate in Reconnect. I used to be also in FASTERN, which I was put in both since the startup of the European Reference Networks. We will explain a little bit later what those are for those patients and other people who do not know what a European Reference Network is. I also am very active in a lot of other, you can read them there. I don't want to waste everyone's time what we exactly do, but you can see that we are both very active in a lot of different patient advocacy work.
Thank you. So I'm Eva, I come from Spain. I am the Vice President of ANSEDH, the Spanish patient organization for EDS and HSD. And also member of the European Reference Network Reconnect and VASCERN, the patient advocacy site. We have no disclosures. So we would like to introduce you to the key points of this project, which we would like to create an opportunity to raise your voice, to give your opinion, to express yourself. So first of all, we're going to explain what it is, what has driven us, who are we addressing, why are we doing this, how are we doing it, first by explaining the history, and then what has inspired us, and then explaining our methodology. Where are we going to apply this survey? When are we expecting to be doing it? What do we expect to get out of it? And we would really like you to join. So what are we doing? We are launching a survey on 3 topics. First, we are focusing on unmet needs. Unmet needs are those issues that are related to EDS in this case, that remain unsolved and that could impact negatively in your life or your professional achievements in all the dimensions you can think of. Afterwards, we're going to ask about research priorities for all the 3 communities we have mentioned before, for patients, for carers, and for healthcare providers. And then we are going to launch a webinar within this fall called Everything We Wanted to Know About EDS. So we would really like to receive your questions for the experts to be answered. As mentioned, we are addressing patients, parents and carers, and healthcare providers, not only doctors. We are also encouraging all allied health professionals to enroll. Why are we doing this? It's because we wanted to get a better insight of each community. We also want to have updated cross-border data and also to be able to compare them. And we also are very curious and would like to see how close or how far we are, each community from each other. So how did it all begin and what is the context? As we mentioned, we are patient advocates in the European Reference Networks. Within these European Reference Networks, we are working in Reconnect. And inside Reconnect, we are working in the Ehlers-Danlos disease group. We're going to explain you a bit about it. So what are the ERNs and what are the EPACs? So the ERNs are reference networks for rare and low prevalence complex diseases. And they gather doctors and researchers who are experts on their field so that they can share their expertise in advising other professionals with complex cases. As mentioned, it's a network of healthcare providers. That is, each ERN includes a group of conditions that are related. They also facilitate the dissemination, exchange, and generation of knowledge, also including the patient's voice. There are 24 ERNs that were launched in 2017, and they are involving more than 900 highly specialized healthcare centers. They are probably more by today, so it's a big group. Where is Ehlers-Danlos represented in these ERNs, in these 24 ERNs? We have Vascairn, that includes a vascular EDS. We have the ERN Skin, that deals specifically with skin disorders in all the types of EDS. And then finally we have Reconnect, that includes the 12 types of EDS that are not vascular EDS. And what are we? What are the European patient advocates? So the European Patient Advocacy Group has as a goal to bring the patient's voice to these European reference networks full of healthcare providers and researchers. Each of these 24 ERNs has a group of patient advocates. And then those members of this European Patient Advocacy Group are called the EPAC advocates. We are involved in a lot of activities, actually, you can read here. We have mentioned them before: creation, dissemination of knowledge, raising the voice of the patient, you name it. And so we are going to talk specifically about Reconnect because this is where it all began. Reconnect is the European reference network for rare and complex connective tissue and musculoskeletal diseases. This is the picture of the last Congress and plenary meeting in April in 2023. This is the list of the diseases that include that get included in Reconnect, and you can see Ehlers-Danlos there along with the other 9. There are 23 European member states working in Reconnect so far. And what do we do in Reconnect? We work on clinical practice guidelines, clinical decision-making tools. We promote research. We work very hardly on education and training, and we also deal with other kinds of transversal activities. And what is the EDS disease group inside Reconnect? Charissa is going to take over and explain to you.
Thank you, Eva. Up until last year, the year and Reconnect worked a little bit differently, and then we changed our way of working. And we specifically made or launched the EDS disease work group instead of, and then worked transversally with the targeted groups that we showed, theme groups. Here you can see that Francesca Monfin, together with Alberta Sully, are the persons who coordinate the disease group. And then Eva and myself are the patient advocates who represent the patient communities. This is not all the people in the work group, but this is also a picture of some of the people from the last meeting that we were at. Now, the method. We had actually had a small idea. We had when I was still in Vascairn together with Eva, we had to make a webinar for the patients community for vascular EDS. And we thought, well, what do we want to do? We want to be able to give the patients a voice. And we want to do something with everything you want to know about EDS. And that's how it started. A simple question. We sent it a survey, and we made a formula. And then we brought it back, and we got so many answers, and we decided, well, this is very interesting. You know, we're getting a lot of unmet needs. Well, unmet needs are actually those needs for patients who don't need, are those things that influence your life, those things around you. It could be your health, it could be associated with your work, it could be associated with how you have to go to work, it could be a social economics. It's just everything that is not met to exactly what's unmet that is needed for you to be able to cope in your life. And we found it so interesting that we discussed it with our coordinators, and we also discussed it with some of our disease people in our disease group, and it became larger. So then we decided, well, wouldn't it be interesting to also compare for the healthcare professionals? So it became larger, and then it became larger again, and now it's, because it's an EDS multisystemic, and it's cross different, and it's going south even internationally. Well, back in 2018, we had even a clinical practice guidelines publication where we also did about unmet needs, about what was missing for the patients and what is missing for the clinical aspects. And we actually then, in 2021, we based it also with a methodology, which we were guided with methodologists. And then we also had a survey specifically done in 2021 to the patient community, where we asked questions, and we did it in all different languages, or several different languages. And we had very interesting patient stories, we called it. This is some from the Dutch. This is just a sample. And we actually, for some of the answers or possible answers that we have included in the survey, which can be added on, this is some typical unmet needs. These are the patient's words, so don't shoot me if it's wrong, that we collected in 2021. So the methodology is based on the EU survey platform from the European Union. It is GDPR compliant. It will be anonymous. It will be, at the moment, translated into 19 languages. It will be fully with analytical and methodological support, and afterwards it will be publication. It will be mainly in Europe, but all countries are welcome. We actually expect that it will probably be also internationally. The survey will be, or we expect to be launched in September, and will be open for 3 months. And also the research projects, what do we expect? We will see which research are important and will align with our priorities and those of the patients. We will gain knowledge, so we will know what we have, what is more important for the patients and what is important for the clinicians and the healthcare providers. We have to align, because sometimes what we think what the patients need might not actually be what the patients need. So we need to raise awareness on this. We need to make tools based on these data. And then we also want to do educational tools and webinars. And we don't know what we will be able to do, but it's going to be very interesting data, which can be very important for the patient community, but also for the healthcare community. So what can you do? Make an impact. You can participate and contribute, fill in a survey. Specifically for our healthcare providers, we ask you to share the survey with your patients. The patients share the survey with your carers and your healthcare providers, and carers share the survey with your healthcare providers. Here, you can also subscribe to the Reconnect survey, Reconnect newsletter. This way you can always follow up the updates, and you can also see when it will be launched. So at the time, we want to give our special thanks to Francisca Moffin and Alberto and the disease group. We also want to thank our Reconnect coordinating team, the EPAC advocates, doctors, and patients that are helping us with the translations data. And we want to thank for the opportunity to be here, and thank you for listening.